Most people have no idea just how common and painful kidney stones really are. In fact, kidney stones affect nearly 1 in 10 people, and the numbers are rising sharply across the world. What's even more surprising is that many people don't recognize the early symptoms, leading them to suffer far more than they need to. Imagine this for a moment. By understanding just a few key warning signs, you could save yourself or someone you care about from days, weeks, or even months of unbearable pain. Over 50% of kidney stone patients miss the early warning signs, confusing them with everyday problems like indigestion, muscle pain, or dehydration. But research shows that many symptoms begin appearing weeks before the severe pain begins, giving you a chance to take action early, prevent complications, and avoid a full-blown emergency. Your kidneys are small, but they play a massive role in keeping your body healthy. They filter waste, balance fluids, and maintain essential minerals. But when minerals start to crystallize and form stones, even a tiny blockage can create intense pressure and trigger a chain reaction of symptoms throughout your body, long before you realize what's happening. In this video, we're going to break down 13 important symptoms of kidney stones, including some that people never associate with this condition. Recognizing these signs early can save you from extreme pain, infections, and long-term kidney damage. Before we begin, let me know in the comments, what is your name, where are you watching from, and what problem are you currently facing? Tell me, and I'll guide you with the right information and solutions. And stay with me until the end, because I'll also tell you which symptoms are considered serious and when you need to see a doctor immediately. If you find this video helpful, make sure to like this video and subscribe for more health tips that can truly make a difference. Let's get started with the first important sign. Number 1. Sharp pain in the lower back. Sharp pain in the lower back is one of the most well-known and alarming signs of a kidney stone. This pain usually begins suddenly and without warning, often on one side of the body just below the ribs. Unlike normal back pain from sitting or lifting, this discomfort feels deeper, almost as if it's coming from inside the body rather than the muscles. The pain is caused when a stone blocks part of the urinary tract, creating pressure inside the kidney. As the pressure builds, the nerves around the kidney become extremely sensitive, sending sharp, stabbing pain through the lower back. This pain can be so intense that it stops you mid-task and makes it difficult to stand, walk, or find a comfortable position. What makes this symptom unique is its unpredictable pattern. The pain can rise in powerful waves, easing for a moment before returning even stronger. Some people feel it radiating toward the abdomen or all the way down to the groin as the stone moves. For many, this is the symptom that finally makes them realize something is seriously wrong. Sharp lower back pain that comes on suddenly and doesn't improve with rest is a major red flag that a kidney stone may be shifting or blocking the flow of urine. Recognizing this early can help you seek treatment before the pain becomes unbearable, or before the stone leads to more serious complications. Number 2. Blood in the urine, hematuria. Blood in the urine is one of the clearest signs that a kidney stone may be causing irritation inside your urinary system. Under normal conditions, urine has a clear yellow color. But when a stone moves or scrapes against the delicate walls of the ureter or kidney, tiny blood vessels can break, allowing small amounts of blood to mix with the urine. This can give the urine a pink, red, or even brownish tint. Sometimes the change is very obvious, but in many cases the bleeding is so small that the color looks almost normal, which is why many people miss it. Even if the urine appears normal to the eye, lab tests often reveal hidden blood. The important thing to know is that hematuria is not caused by dehydration or diet. It's a direct sign of internal irritation or injury caused by the stone's movement. As the stone tries to pass through tight spaces, it scratches the inner lining of the urinary tract, leading to this bleeding. For some people, the bleeding comes and goes, depending on whether the stone is moving. For others, blood appears only during moments of intense pain. But even small traces of blood should never be ignored, because they can signal that the stone is larger, sharper, or causing more irritation than expected. Blood in the urine is your body's way of telling you that something is damaging or stressing the urinary system. Catching this symptom early can prevent more serious complications, including infections or complete blockage. 3. Painful urination. Painful urination is one of the earliest and most noticeable warning signs of a kidney stone, and it's a symptom that many people ignore until the pain becomes unbearable. But understanding why this pain happens can help you act faster and protect your kidneys from further damage. Your kidneys filter waste and send urine down through thin tubes called ureters. When a kidney stone forms, it can move into these tubes and scratch, irritate, or block the normal flow of urine. This creates pressure and inflammation along the urinary tract, turning something as simple as using the bathroom into a sharp, burning, or stinging experience. For many people, this discomfort starts as a mild irritation, a slight burning feeling when you pee. But as the stone travels further, the pain can grow more intense, sometimes feeling like razor-sharp sensations deep inside the lower abdomen or pelvis. What makes this symptom especially confusing is that the pain often comes and goes, making it seem less serious than it really is. Painful urination is not just an inconvenience. It's your body's way of warning you that something is blocking or irritating the urinary system. Recognizing this symptom early can help you identify kidney stones sooner, seek proper treatment, and prevent more severe complications like infections or complete urinary blockage. Number 4. Nausea and vomiting. Nausea and vomiting may not seem directly connected to kidney stones, but the link is stronger than most people realize. When a stone shifts or blocks part of the urinary tract, it puts pressure on the kidneys and disrupts the natural balance of fluids and waste in the body. This sudden stress sends signals to the nervous system, especially the same pathways that control your stomach. As a result, your body reacts with intense waves of nausea, sometimes strong enough to trigger vomiting. This often happens alongside severe back or side pain, but it can also appear on its own, making the cause hard to identify. For some people, the nausea feels like motion sickness, a constant queasiness that refuses to settle. For others, it comes in sudden episodes, especially when the stone moves or when the pain spikes. Vomiting doesn't provide much relief because the root cause isn't in the stomach. It's the body struggling to cope with the pressure on the urinary system. These digestive symptoms are your body's emergency warning system, telling you that something is irritating or blocking the kidneys. Ignoring them can lead to dehydration, added kidney stress, and worsening pain, making early recognition especially important. Number 5. Foul-smelling urination. Foul-smelling urine is another early sign that a kidney stone may be interfering with your urinary system. Normally, urine has a mild, almost neutral smell, but when a stone forms, it can disrupt the smooth flow of urine, allowing waste products to sit longer than they should inside the urinary tract. As this happens, the urine becomes more concentrated and starts developing an unusually strong or unpleasant odor. Some people describe it as a sour smell. Others say it's much stronger than their usual urine scent. But the key point is that it feels noticeably different from your normal routine. This change happens because the stone irritates the lining of the kidneys or ureters, causing tiny bits of waste, minerals, or bacteria to mix more heavily into the urine. Even a small stone can create this kind of imbalance, especially if it slows down the urine flow. Sometimes the smell appears before any pain or other symptoms show up, making it easy to overlook. But paying attention to this early change can be incredibly helpful, because it often hints that the urinary system is under stress and may soon develop more serious symptoms. Foul-smelling urine is not just a hygiene issue. It's your body's subtle signal that something deeper may be going on inside the kidneys, and it should not be ignored. Number 6. Groin pain. Groin pain is one of the clearest signs that a kidney stone has started moving lower in the urinary tract. As the stone travels from the ureter toward the bladder, it passes through extremely narrow spaces. This tight passage creates sharp, shooting pain that can spread down into the groin area. This pain often feels very different from muscle soreness. Instead, it comes as sudden waves that rise and fall, sometimes so intense that it becomes difficult to stand, sit, or even find a comfortable position. For some people, the pain radiates from the lower belly into the inner thigh, making it confusing to pinpoint exactly where the discomfort is coming from. What makes groin pain especially important is that it usually means the stone is shifting, and the movement itself causes irritation to the delicate tissues around the bladder and urethra. This irritation sends pain signals to the groin nerves, creating a deep, pulling sensation that can be both sharp and persistent. Many people mistake this symptom for a muscle strain or a reproductive organ problem because kidney stone pain often spreads or travels. But unlike muscle pain, groin pain from a stone rarely improves with rest, stretching, or massage. It tends to come in intense bursts, especially when the stone tries to move forward. This type of pain is your body's way of warning that a stone is nearing the bladder and may soon cause more noticeable urinary symptoms. Recognizing it early can help you seek treatment before the discomfort becomes overwhelming. Number 7. Frequent urination. Frequent urination is another warning sign that a kidney stone may be moving deeper into the urinary tract. As the stone gets closer to the bladder, it irritates the surrounding tissues and triggers the nerves that control your urge to pee. Even a small amount of irritation can make the bladder think it's full, even when it's not. This leads to a strong, constant need to urinate, sometimes every few minutes, but with very little urine actually coming out. Many people describe it as an uncomfortable pressure in the lower abdomen, almost like the bladder is being squeezed from the inside. What makes this symptom confusing is that it often feels similar to a mild urinary infection. But in the case of a kidney stone, the frequent urge doesn't come from bacteria. It comes from the stone rubbing against sensitive areas, sending false signals to the brain. For some, this frequent urination becomes worse at night, causing multiple bathroom trips that interrupt sleep and increase fatigue. For others, the urge appears suddenly, especially when standing up or walking, because movement can shift the stone and intensify the irritation. Frequent urination isn't just an inconvenience. It's the body's way of alerting you that something is disturbing the bladder or ureters. Paying attention to this early change can help you identify a kidney stone before it causes more severe symptoms or complete blockage. Number 8. Fever and chills. Fever and chills are one of the most serious warning signs connected to kidney stones. When a stone blocks the flow of urine, bacteria can start multiplying inside the urinary tract. This can quickly lead to an infection, and the body responds by raising its temperature to fight it off. This sudden rise in temperature often brings intense chills, the kind that make your whole body shake even if the room is warm. Some people feel waves of heat followed by strong shivering, while others notice the fever coming on with weakness, sweating, and a general feeling of being unwell. Unlike common fevers from colds or flu, the fever caused by a blocked kidney can feel sharper and more alarming. The chills may come in sudden bursts, and even simple movements can make them stronger. This happens because the infection is not on the surface. It's deep inside the urinary system, where the kidneys are struggling to push urine past the blockage. What makes this symptom especially dangerous is that it often appears when the stone has already caused significant irritation. If ignored, the infection can spread quickly and lead to serious complications that require urgent medical treatment. Fever and chills are your body's emergency alarm, telling you that the kidney stone isn't just causing discomfort. It may be creating an infection that needs immediate attention. Recognizing this symptom early can protect your kidneys and prevent a minor issue from becoming life-threatening. Number 9. Cloudy urine. Cloudy urine is another important sign that a kidney stone may be affecting your urinary system. Normally, urine is clear or slightly yellow, but when a stone causes irritation or slows the flow of urine, tiny particles like minerals, white blood cells, or protein can mix into the urine and change its appearance. This makes the urine look milky, hazy, or unusually thick, almost as if something has been stirred into it. The change can be subtle at first, but it often becomes more noticeable as the irritation inside the urinary tract increases. Cloudy urine can happen when the body is trying to fight off early inflammation, or when a small amount of bacteria begins to build up around the stone. Even if there's no strong smell or pain, this visual change is a sign that the urinary system is under stress. Some people only see the cloudiness at certain times of the day, especially in the morning when urine is more concentrated. Others notice it every time they use the bathroom, making it easier to realize that something isn't normal. Cloudy urine is more than just a hydration issue. It's your body showing you that the kidney stone may be causing irritation or an early infection. Paying attention to this simple visual clue can help you take action before the condition becomes more painful or complicated. Number 10. Restlessness and inability to lie still. Restlessness and an inability to lie still are classic signs that a kidney stone is causing severe internal discomfort. Unlike many other types of pain, kidney stone pain often comes in sudden, powerful waves that make it nearly impossible to stay in one position for long. When the stone moves or presses against a sensitive area inside the ureter, it sends sharp, intense signals through the nerves in your back and abdomen. This kind of pain is so strong and unpredictable that the body reacts by forcing you to shift, stand up, walk around, or constantly change positions in an attempt to find even a few seconds of relief. Many people describe this feeling as a deep, twisting pressure that refuses to settle, no matter how they sit or lie down. You might try lying on your side, curling up, or stretching out, but the discomfort keeps pushing you to move again. This constant shifting is not just restlessness. It's your body trying to escape the sharp internal pressure caused by the stone. What makes this symptom unique is that it clearly separates kidney stone pain from common muscle or back pain. Muscle aches often improve with rest, but kidney stone pain usually becomes stronger when you stay still. The only temporary relief often comes from walking or changing positions, even though the pain can return within minutes. This restless behavior is your body's automatic response to intense internal stress. Recognizing it early can help you identify a kidney stone before the pain becomes even more severe or before other symptoms start to appear. Number 11. Excessive sweating. Excessive sweating, also known as diaphoresis, is another signal that your body may be struggling with a kidney stone. This kind of sweating isn't caused by heat, exercise, or stress. It appears suddenly and often during moments of intense internal pain. When a kidney stone moves through the ureter, the body reacts by activating its fight or flight system. This rush of stress hormones increases your heart rate and triggers heavy sweating as the body tries to cope with the sharp, deep discomfort coming from the urinary tract. For many people, the sweating starts at the peak of the pain, especially during those strong waves that radiate through the back, abdomen, or groin. You may feel your skin becoming cold and damp, even if the room temperature is normal. Some experience sweat forming on the forehead, chest, or palms, while others notice sudden episodes of full-body sweating. This isn't the light perspiration you get from normal activities. It's the kind of intense, uncomfortable sweating that appears without warning, often accompanied by weakness, dizziness, or a feeling that something inside isn't right. Sweating in this situation is your body's natural response to severe internal stress. It's trying to release tension and deal with the overwhelming signals from the kidneys and urinary tract. When paired with other symptoms like sharp pain, nausea, or frequent urination, sudden sweating becomes a strong indicator that a kidney stone may be moving. Recognizing this symptom can help you understand the seriousness of what your body is experiencing and encourage you to seek proper medical attention before complications develop. Number 12. Reduced urine output. Reduced urine output, also known as oliguria, is a serious sign that a kidney stone may be blocking the normal flow of urine. Under healthy conditions, your kidneys filter waste and produce a steady amount of urine throughout the day. But when a stone becomes lodged in the ureter, the narrow tube that carries urine from the kidney to the bladder, it can slow down or even partially stop this flow. As a result, you may notice that you're producing much less urine than usual, even if you're drinking enough water. Bathroom trips might feel unproductive, with only a few drops or a small trickle coming out, despite strong urges to pee. This happens because the stone creates pressure inside the kidney, making it harder for urine to move downward. Over time, this pressure can become painful and cause the kidney to swell, which is why reduced urine output should never be ignored. Some people also feel a tight, uncomfortable sensation in the lower abdomen or sides because the urine has nowhere to go. If oliguria continues, it can quickly lead to dehydration, increased pain, and even kidney damage. Reduced urine output is the body's clear alarm that something is blocking the urinary system. Recognizing this early can help prevent long-term harm and encourage faster medical attention. Number 13. Bladder pressure. Bladder pressure is another strong indicator that a kidney stone may be moving closer to the lower part of the urinary tract. As the stone approaches the bladder, it irritates the surrounding tissues and creates a deep, constant sense of heaviness in the lower abdomen. This pressure often feels like the bladder is completely full, even when only a small amount of urine is present. Many people describe it as a tight or pushing sensation just above the pelvic area, almost as if something is weighing down inside the lower belly. Unlike normal bladder fullness, this feeling doesn't go away after urinating. In fact, the pressure may continue or even worsen, especially if the stone is rubbing against the bladder wall or blocking the urethra's opening. For some, this symptom causes discomfort when sitting, bending, or walking. For others, it creates a constant urge to urinate, but with little relief afterward. This happens because the bladder's nerves become highly sensitive to the irritation caused by the stone. Bladder pressure is your body's way of showing that the stone is nearing the end of its path, a stage where symptoms often intensify. Paying attention to this sensation can help you identify a kidney stone early and take action before the discomfort becomes more severe. Kidney stones may not be silent, but they are often misunderstood. What makes them so dangerous isn't just the pain, it's how easily their early symptoms can be dismissed as simple back strain, dehydration, or just a normal urinary infection. But as you've seen, these signs are not random. They are your body's warning signals, trying to tell you that something is blocking, irritating, or stressing your kidneys. By recognizing even a few of these symptoms, whether it's sharp lower back pain, painful urination, cloudy urine, nausea, or foul-smelling urine, you give yourself the chance to act early. Early awareness can help you reduce pain, prevent infections, and avoid serious complications like kidney damage. The truth is simple. Understanding your body can protect your health, and sharing that understanding can help others protect theirs. If this video helped you learn the hidden signs of kidney stones, imagine how many others could benefit from this information. So please, subscribe to our channel, turn on notifications, and help us continue spreading clear, life-improving health knowledge. Thank you for watching. And remember, your awareness today could save someone else from unnecessary pain tomorrow.